everyone, it's Dr. Danielle Cooper here, plastic surgeon. I wanted to create a quick video to discuss the different types of anesthesia that you may need to know about if you're undergoing plastic surgery. So anesthesia is either using a medication through the IV or a combination of gas, which we give to you through the mask, to put you into a more comfortable state, either sedated or completely asleep, so that we can perform our procedures. So there's three different forms of anesthesia. The most basic is called local anesthesia. That's if we're using numbing medication like lidocaine. So for example, if you want to have a mole removed, then we use local anesthesia where we numb up the area with lidocaine, then we take your mole off, we sew it up, and you're good to go. You're not asleep, you're still awake during this procedure. We just numb the area and you don't feel any pain. And we're able to perform the procedure. That's probably the most basic form of anesthesia. And then you have the next level up, which would be, I guess it's a type of local anesthesia. We may call it regional anesthesia, where you're getting medication that it blocks a region of the body. I think the most common thing that people can relate to would be an epidural if you're having a delivery, if you're pregnant. So you're still awake, but we numb essentially the lower half of the body with an epidural. And so we call that a regional anesthesia, where you're still awake, but only part of the body is being numbed so that you don't feel the pain. I would say in plastic surgery, something that's similar to a regional anesthesia would be during liposuction. You can do something called awake liposuction, where patients, maybe they're getting given a little bit of oral medication just to try to keep them calm. But the main anesthesia comes from the tumescent, or the fluid that we inject during the liposuction procedure, that has lidocaine in it. And so it numbs the entire area where we're going to do liposuction so that you are comfortable. And so that's a form of regional anesthesia that we might use as plastic surgeons. Then the next level up would be sedation. So this is when you're given usually medications through your IV, and you are awake enough to where you're still breathing on your own, like you don't need a breathing tube down your throat, but you are comfortable enough and kind of in la-la land where you're falling, you're like in a light sleep. Usually with sedation procedures, we're also using local anesthesia. So we'll sedate you kind of deep enough to where you are still able to breathe on your own, but that you're kind of in la-la land. And then we'll numb up whatever area we're working on. And once that area is numb and you being in la-la land, you're able to get through the procedure just fine without any discomfort. I would say the most common procedures that we would use sedation on would be facial procedures. So it's not uncommon for surgeons to be out there performing a facelift or a neck lift with the patient sedated, because again, we use lidocaine to numb the face as well. And patients tend to tolerate these procedures very well under sedation alone. But a lot of surgeons will still do facial procedures under general anesthesia, which is the next level up. And that is when you are completely asleep. You have a breathing machine where the anesthesia provider will be putting usually a tube down your throat, and the machine is hooked up to your breathing tube, and the machine breathes for you. That's general anesthesia, and that's what we use probably for the majority of our plastic surgery procedures. Like I said, mainly with facial procedures, you're able to get away with doing them with sedation, but there's still, I would say, majority of surgeons will still do facial procedures under general anesthesia as well. But that is the highest level of anesthesia, where you are completely out. You remember nothing, you feel nothing. There's no, you have the machine essentially breathing for you because you're completely sedated. And people will have different fears and worries about different types of anesthesia. Some people are really worried about being put under general anesthesia because they're worried about not waking up afterwards. I would say that is not something that you should be worried about, because that's very rare that somebody would not wake up from general anesthesia. But nonetheless, people have that fear out there. And so they try to look for surgeons that are willing to do certain procedures under sedation or awake surgery. So I think you should just have a conversation with your surgeon, what your concerns are as far as the anesthesia is concerned. Usually at the time of your procedure, you're also able to speak to the anesthesia provider who can give you further information about what type of anesthesia they're planning on using for you and answer any questions that you may have, and then go from there. So I hope this was informative about anesthesia, and if you have any questions, leave them in the comments below.